Hello and welcome to Birdseye Financial Medicare 2025. We're going to try something new today. We're going to try to make a video that goes through the PPO Medicare plans for Snohomish and King County that we recommend, that we really like. This will give you the ability to rewind it, fast forward it, take notes, and really give you more time to be able to explore the differences of the plans. And we want to make sure we equip you with these tools. So let me know what you think. But first off, I'll start off by introducing myself, Corbin Lindsay. As most of you know, Birdseye Financial, there's a lot of different products and planning that we offer. All of our planning is done at no cost to you. Part of our team today is Beth Daniels. She's our office admin. She does a lot of our paperwork and applications. And then Angie Kessler-Walsh. She is joining us for the second year of helping us with Medicare. She's very experienced and has done a great job with helping many of my clients be able to better understand Medicare. So if you speak to myself or to Angie this year, have the list of questions that you would like for us to answer. I'm going to jump over to the software that we use, and many of you have this AARP by United Healthcare plan. The number is called 002. That's the plan number, but on your card it would say H1278-029. So I know most of you have that plan. It's been a very attractive plan. You may want to keep that same plan, or you may want to make an adjustment and switch over to the WA12 Plan PPO, also by United Healthcare. I think they're both very competitive. There are some differences, and we're going to go through those shortly here. I've also included Humana's PPO. Normally, I'm not a big fan of Humana PPO for when you're out of network and traveling because the costs are higher. But on this specific plan, it's got really high dental coverage, which is very unusual. And that's about the one area that I really like about it. But for the most part, we're going to focus on the first two columns. So first off, we have monthly premium. How much do you pay? Well, all three plans are $0. How about a medical deductible? Some plans do have medical deductibles, but all three plans have a zero medical deductible. This next section, I want to make sure I explain for you. There is a in-network out-of-pocket maximum. So the cost went up to $7,900 on the plan that most of you have, but the plan I recommend in the middle is $6,700. It's keeping that maximum out of pocket pretty low. We could find other plans on the market that have even lower, but there might be a cost of a monthly premium or a medical deductible. You got to be very careful about that. As far as the max out of pocket, so if you used out of network benefits, it could cost you more, and the max out of pocket could go as high as $14,000 versus $10,100. You might be understanding why I'm starting to recommend the plan in the middle. The Humana choice is really high on the in-network, and the combined in and out of network maximum of 11.5 is high, not as high as the one that ARP has here, but it's definitely higher than the WA12 that I'm now recommending to most of my clients. Drug deductible is $570 versus $420 and $350. Let's go talk about drug deductible for a second. On my website under Insurance, Medicare, Education, you can scroll down to the drug plan information and take a look at this. Let me go back to where we are at with 2024. 2024, like most years, we had these 4 stages of drugs. The first stage was the deductible stage, and the drug deductible maximum was $545. Didn't mean that you were charged that, but that was the maximum. And it only applied to tiers 3, 4, and 5. Your generic drugs are considered tiers 1 and 2. Your brand name drugs are considered tiers 3 and 4. And then you have your specialty drugs, which are considered tier 5. If you had a deductible that was applicable, you would pay the drug deductible first, and then you move into what most people have, which is called the initial coverage. The initial coverage could be 25% of the cost or better. As you know, many drugs are better. Some of them are free. They're even $0, right? When I look at the max out of pocket, that is the $5,030 was the cost of you and the insurance company paying for the drugs in the initial coverage. If you went above the $5,030, you would have been in the coverage gap for 2024. Your cost in the gap is 25%. They have done away with the coverage gap going forward in 2025. If someone did $8,000, it used to be a cost for catastrophic, but in 2024, they brought that price down to zero. So essentially, what did they do was they revamped this whole Part D, and they said $2,000 is your maximum. If you have a deductible, it could be as high as $590. Again, it applies to your brand name drugs, tier 3 and 4, and specialty drugs. No deductible for tiers 1 and 2. There could be some expenses given to the insurance company because the way that they've been able to do this $2,000 maximum is that they have shifted the burden of anything above $2,000 to the insurance company instead of the drug manufacturer. So we got to keep our eyes on these plans specifically. So the plan that most of you have, which has been a great plan, has gone up to $570 on that drug deductible. The plan I recommend is at $420, and Humana is a little bit less at $350 on the brand name drugs and specialty drugs. Again, the maximum that you can pay on your drugs is $2,000. That is separate from the out-of-pocket for medical. So let's just say somebody had a in-network maximum out-of-pocket of $7,900. They could essentially be paying another $2,000 for their medications. I hope that makes sense. If not, make sure you ask Angie or I when you have your Medicare meeting. Items like acupuncture, even though it says NA, is included. Acupuncture is included with Medicare. Additional services like your active membership for Health Club, that's included. Ambulance service is $290, regardless if it's ground or air ambulance. Humana is a little bit off on their air ambulance, $1250 instead of $290. If I go to chiropractic services, 15 versus 20. If I look at dental services, now this has kind of been a big change. They went to preventative at 20%, but when I look at the plan in the middle that I'm recommending, the preventatives are included at no cost for quite a few of the items, and they're giving you the $500 maximum out-of-pocket benefit. That 500 is what you currently have for 2024, but it's going away on the plan that you currently have on the left. So if you're wanting to keep that $500, you probably want to switch to the plan I'm recommending. Let's go down. Oh, I will mention that the Humana plan, the reason I have it up here is because it's got a crazy $4,000 maximum benefit. Whew, that's high. That's one of the highest I've ever seen. So if you've got pretty good health, you want to take your chances on the medical side, and you need dental, that might be a really good benefit. Just make sure you know what's covered under that $4,000. Let's go down to diabetic supplies. That's included across the board. Let's go down to the important category of diagnostic testing, radiological services, and x-rays. The more expensive is your MRIs and CT scans. The plan is currently at $250 for next year. If you change the plan I recommend, it's $170. And it's a little bit high with Humana. Again, not my favorite plan. Maximum could be $400. What if you need two of them? Might be much cheaper, pay $170 a couple times. Therapeutic radiological services, that's also cancer related, that's in here, that's always going to be 20%. That's possible that you could max out your plan that way. Doctor visits are 0 across the board. And it's not printed on this diagram here, but if you go out of network, it's going to be $25 for a doctor visit. And this is why I'm showing Humana as well, because Humana is not the best at out of network. It's 50% of the cost versus $25. So if you want to see that, just open up the summary of benefits. The link is right down below this video. Doctor specialty visits, 0 to 45 for either plan, 50 with the Humana. And again, if you go out of network with Humana, it's 50%. but it's only $70 or $75 with the United Healthcare plans. That's why I really like United Healthcare for if you're traveling or you just can't get all of your doctors, specialists in network. I do like the United Healthcare plans. Durable medical equipment. What are we talking about? We're talking about oxygen, wheelchairs, and walkers. That's always kind of been around 20%, 15 with Humana. Come down to the emergency care, $110, $125, fairly close together. It is worldwide coverage, so if you need urgent or emergent care, that's emergency room or urgent care, it's free worldwide, 110 with Humana. But urgent care is going to be much cheaper than we're seeing here. We're going to talk about that in just a moment. Hearing services. So you do get a routine hearing exam. Hearing aids are $199 to $1249 with United Healthcare. You get the same hearing exam with Humana, and it's $699 to $999. Let's see, home health care. Home health is if you come home from the hospital and you need a little extra assistance, you need a nurse or physical occupational speech therapy to stop by. There is no additional cost. It's limited time that they will help you, but there is no cost for that. Outpatient mental health care. And if I'm going too fast, you just can hit the rewind button, go back through it, write down any questions that you have, and we'll be sure to tackle those more in depth with you during our meetings. When we talk about outpatient prescription drugs, that's where we start talking about chemotherapy. Chemo can be a range of 0 to 20%, very expensive. That might be a reason why some people might want a low deductible, max out of pocket, I mean, or they might want to try to look at getting onto a supplement. Outpatient rehab. Many of you are familiar with some of the disciplinaries like cardiac and pulmonary rehab, pretty cheap, $0 with ARP, 10 with Humana. The occupational, physical, and speech therapy, 0 to 25 under occupational, up to $40 with physical and speech. With the plan in the middle, it's 45 or 50. Not sure why OT is a little cheaper, but that's just the way they priced it. Keep in mind if you're out of network, you could pay up to 30%, or if you can be in network, you're getting speech language pathology, that could be a fixed rate. So just be sure you know your prices. Outpatient surgery, another big category. It's broken up into hospital and non-hospital. So let's take a look at it. $390 for in-hospital services. That could be a surgery, a biopsy, maybe cataract surgery on your eyes. But if it's not in the hospital and you're in a surgical center, it's a little bit cheaper. Maximum is $340. If I look at the Humana plan, for example, it's $400 for hospital and it's $300 for surgical centers. So not that big of a difference between the two. If you're out of network, this is a huge benefit. Out of network to me means that you're probably making a choice to go out of network and you want to pick a hospital of your choice. Maybe you're going to fly over to Mayo Clinic or Johns Hopkins Hospital. With a lot of plans, if you have to pay 50%, you're going to max out pretty quickly. But here it's $595 for each day that you're in the hospital. That's not cheap, but it's a lot better than paying 50% of the max out of pocket, 50% of the cost, which would probably max out your maximum out of pocket expenses. Outpatient substance abuse, over-the-counter items, not available on the current plan that you may have, but the PPO I recommend in the middle is going to be $35 every 3 months. Some of those dollars have decreased over the last year because of the Part D, in my opinion, is going to be costing the insurance companies more money. Podiatry services, that is for your feet, so 35 versus 40 versus 50. Little juggling around there. Preventative services are free as long as they're routine. They're the same for all the plans. Maybe it's bone mass or colonoscopy. Maybe it's diabetes screening, depression screening. Maybe you need to have a mammogram or a prostate check or a flu shot. Those are all included along with your wellness exam. Prosthetics and renal dialysis, very expensive. That's going to be 20%. That means that you pay 20 and the insurance company picks up the 80% required. Hopefully you don't need either of those. Now we're back down to urgent care. We talked about emergency room, and urgent care is a lot less. It's up to $45 for your visit. Worldwide with ARP, it's free, and with Humana, it's around 110. Last category on Part B that we talk about is routine eye exam. So your plan does give you $200. If you switch to the plan I recommend, you get $300 for glasses, frames, contact lenses. With the Humana plan, they've dropped it down to $100. Now we jump over to hospital, which is considered Part A. Hospital cost is $390 for days 1 through 5, nothing for days 6 through 90. Humana is a little bit pricey, $597 for 4 days, but it is 4 days instead of 5. Fairly close when you look at the total number, but they're going to get the money faster up front. If you got transferred from a hospital to a skilled care, the first 20 days are no cost, and then it's $203 till you max out your plan. Probably max it out around day 50, 55, something like that. If you do the math, you can't even get to day 100. So all these copays, if they added up together, you had a really bad year, the maximum that you would be responsible for Medicare covered services is located right here at the top, $7,900 in network, $14,000 out of network with your current plan. Or the plan I recommend keeps it pretty close to the same, $6,700 in network, $10,100 out of network. This is the plan I recommend. I think it's a very good plan. Nothing wrong with the plan on the left. I just think the one on the right's a little bit better. So if you want to make those changes, you have additional questions during the Medicare meeting with myself or Angie, be sure to bring those up. We'll go over your drugs specifically with you. And I hope you have a great year, and I look forward to talking with you soon. Bye-bye.